Are you 64 and you're turning 65? Well, if you're approaching your 65th birthday, your mailbox is probably overloaded with those shiny Medicare booklets, and your phone won't stop ringing with those calls from the telemarketers out of those call centers, right? I mean, everyone's trying to sell you something, but almost no one's telling you about the strict legal deadlines that can penalize your retirement savings for the rest of your life. You see, the federal government does not send out a friendly warning text when that window of opportunity opens. And if you miss that window, you'll face lifetime financial penalties that'll never disappear. I see it all the time. Those Medicare forms retirees are screaming because one simple logical assumption that turned out to be a massive violation of the Medicare rules. They assume that because they're healthy or because they had insurance through a spouse, that they could just handle Medicare later when they felt like it. Well, today we are putting a stop to all this confusion, and I'll be walking you through a definitive turning 65 checklist, and I'll be explaining some of those exact rules that you'll have to follow to protect your health, but also your wallet. I mean, that's where they get you. The first item on our checklist is understanding what's called the initial enrollment period, which is a strict 7-month window that's tied directly to your 65th birthday. And when that window opens exactly 3 months before your birthday, also your birthday month is included, and then it extends for another 3 months thereafter. And if you're already on Social Security collecting those benefits when that window opens, well, the government, they're going to automatically enroll you into Parts A and B. But if you're not yet drawing Social Security, that responsibility is entirely on you to manually log into the system and sign up. That brings us to the biggest trap that catches most of us completely off guard: the working past 65 rule. Millions of Americans keep working past 65. They have to. And they want to stay on their employer's health insurance. They assume that since they have active workplace coverage, that they can safely ignore Medicare Part B without any consequences. That assumption can be a multi-thousand-dollar lifetime mistake, depending entirely on one single rule, the 20-employee rule. You see, under federal law, if your employer has fewer than 20 employees, your workplace insurance automatically drops to secondary coverage, and that happens the exact day you turn 65. That means Medicare becomes your primary insurance whether you signed up for it or not. And if you fail to enroll in Part B because you think your small business insurance plan covers you, and you break a leg or need medical procedure or something worse, your workplace policy can legally refuse to pay that bill because Medicare was supposed to pay it first. You'll be left in the cold, holding the entire financial burden all to yourself. And if your company has more than 20 employees, you are allowed to delay the Part B without a penalty, provided your employer plan is deemed as credible coverage by the government. But the moment you leave that job, that coverage ends. That opens up Special Enrollment Period, and that gives you a strict 8-month window to enroll in Part B. If you miss that window by even one single day, you'll be hit by a mandatory late enrollment penalty, and that penalty is 10% every 12-month period you went without that credible coverage, and that penalty is tacked onto your premium for every single month for the rest of your life. There is no escaping it. Now, the final item on the checklist is the Part D prescription drug penalty, which is actually the easiest one to trip over. Even if you don't take a single prescription medication right now, the federal government mandates that you must maintain credible drug coverage. If you go without Part D plan or an approved alternative for 63 days or more after your initial window closes, Medicare will penalize you 1% of the national base beneficiary premium for every single month you delayed that enrollment. When you finally do need prescription medication 10 years down the road, did you know that your monthly drug plan bill will permanently be inflated for the rest of your life? So what action plan can protect your finances in your retirement? Well, if you're turning 65 and your employer has fewer than 20 employees, you must enroll in Part A and Part B during that initial 7-month window. If you work for a larger company, get a written letter of credible coverage from your human resources department, and remember that every single year you'll need to document that exception. Never rely on casual conversations with friends and coworkers when it comes to federal enrollment timelines. If you want my team to review your specific employment status and verify your deadlines so you don't get stuck with these lifetime penalties, just click on the link below. Hey, thanks for watching, and I'll see you on the next video.